adequate attention to the consequences. That's the meaning of undue influence. For our Research Ethics Committee, following the national guidelines, we sometimes outline vulnerability into three major headings. Those who cannot give consent by virtue of possible mental incapacitation or because of immaturity, such as fetuses, infants, and children. Those of a situational vulnerability, such as the poor, who are easily coerced, victims, and there's also a relational vulnerability. For example, students may be vulnerable to their professors when their professors do research and actually recruit them as research participants. Prisoners are in that category. Patients when they're being recruited by their own physicians to do research. Soldiers, no? And so forth and so on. And guidelines say that in reviewing research studies involving all categories of vulnerable participants, ethics review committees must determine that their use is adequately justified and that additional safeguards are implemented to minimize risks unique to each group. In other words, it's okay to do research among a vulnerable population as long as the research will have the prospect of improving the welfare of this population as a population, of the group. No? Our national ethics guidelines, in guideline number 18 of the ethical guidelines for health research, in this publication states, and I quote, some populations require special protection because of characteristics or situations that render them vulnerable. Vulnerable groups should not be included in research unless A, such research is necessary to promote the health of the population represented, and B, such research cannot be performed on legally competent persons. Now, what we did to prepare for this talk was to go over the data of the researches that were submitted to the UP Manila Research Ethics Board for ethics review. Just to give you a one-page description of our ethics board, we review researches conducted by members of the faculty, students, hospital staff, residents, fellows, and other trainees and employees of the University of the Philippines, Manila, as well as non-UP Manila principal investigators, especially if a study is being conducted in a site which does not have a local ethics committee. Aside from reviewing, the members of the board are often asked to lecture in workshops and seminars on GCP, and during these workshops and seminars we include guidelines for conducting researches among vulnerable populations. So it's like saying that researchers from UP Manila actually have no excuse for not knowing what vulnerable populations are if they attend our workshops and seminars. So the objectives of this research were to determine whether researchers recognize the concept of vulnerability in populations included in health research submitted for ethics review, and to enumerate some of the safeguards and protection instituted by researchers in the studies involving vulnerable populations. So our methods are actually very simple. We reviewed researches which were submitted to the UP Manila Rep for ethics review from January to July 2013. We focused on the faculty researches and trials that were submitted, and we used our database to filter these researches and triangulated into the decision with the comments regarding these researches and our decision with our minutes database. Then we retrieved some of the protocols and we reviewed their content for provisions for additional participant protection. So these are our results. No? So there were 233 protocols submitted between January 1 and August 15. We excluded 126 protocols from non-faculty and those which were not yet assigned for review. And so in this review, we have 107 protocols. In our submission checklist, we asked our researchers to tick the box on whether the population included in their research were vulnerable or not vulnerable, and we even asked them to specify what these populations are. And actually 60 out of the 107 protocols picked in the application not applicable. So we asked, vulnerable ba yung population na gagamitan nyo, ginagawa nyo na research? They said not applicable. And another 43 specified that they were vulnerable. And there were another 4, I think, which were blank. You know? So this was the breakdown. So out of 233, we removed those from non-faculty and non-clinical trials. We had 102, 61 declared their populations as not vulnerable. And on review, 36 of the 61 were actually not vulnerable. So 25 out of the 61 were considered misclassified. Of the 41 researchers which declared that their populations were vulnerable, 36 out of the 41 actually were correctly classified. And 5, we felt that 5 were not actually vulnerable even if the researcher declared them as vulnerable. So let's look at the breakdown first of the 41 that was declared vulnerable, just to see what kind of populations they employed. So most of these were children under 18, children, again, under 18 but living in an institution, elderly, 2 using indigenous populations, 9 who had a mixed group of patients, children, elderly, indigenous populations, poor and unemployed, patients in emergency care, 4, and 10 patients with renal failure, COPD, or cancer. Actually, this is the graphic representation of that, but the most common was children under 18. So, most commonly correctly classified studies involved patients of ages under 18. The more interesting result actually was that of those who said not applicable sa vulnerable. So of those not applicable, 25 out of 61 or 41% was actually misclassified. And of the 25, the most misclassified were studies done on the elderly. Then there were 3 involving children under 18, 1 graduate student considered vulnerable because it was their teacher who was doing studies on the students, health workers wherein it was their immediate boss who were doing studies on the health workers, 1 on indigenous patients, PGH patients, especially if they were patients of the principal investigator, patients in emergency care, and there was 1 study involving all age groups, involving people on welfare, social assistance, poor and unemployed, so clearly vulnerable, and yet it was misclassified as not vulnerable. So this is just the graphic representation of that. So we picked from these charts and looked at what were the safeguards that were introduced by either the UP Manila rep or the principal investigator. But I will show you the safeguards that we felt had to be included in some of these studies. So we required procedures for documentation of competence, especially among the elderly. Our national ethical guidelines, if in case you did not know, classifies the elderly into the young old, middle old, and old old. And our guidelines that state that for the middle old and old old, there should be procedures to document competence using the mini-mental status examination. And so for some of these elderly populations, it was required by the UP Manila rep that they could do these procedures. Of course, assent for children. Many of the studies among children didn't even have assent, but had consent for the parents of the children. Continuing consent for the elderly. The 4th one, creation of a social harm committee, was a particularly difficult protocol. It was a study which was being done among institutionalized children who were actually street children, many of whom were no longer under the care of their parents. And so simply interviewing them was exposing them to some amount of vulnerability and stigmatization. And this was not a trial, but it can be likened to a data safety monitoring board. The UP Manila Rev asked that the study create a social harm committee to see to it that none of the participants in this research would undergo some amount of harm. We also asked for the inclusion of advocates, especially in the IP studies. We asked for some studies to include members of the indigenous populations themselves, or qualified expert in study teams. For example, there a study which was looking at depression among cancer patients, but clearly the PI was not qualified to handle a crisis if in case the patients just broke down while being interviewed. And the last was post-trial access for studies which we felt had interventions which were too expensive to be afforded by the research participants. We had asked for provisions to give them access to the intervention if in case they were found to be effective. So actually this is my last slide. I just like to conclude that 30% of researches submitted to the UP Manila Red were actually misclassified in terms of classifying the types of populations. The population most correctly classified as vulnerable were population of children. The population most misclassified was the population of the elderly. And we further conclude that researchers need to be made aware of vulnerable populations and how to address vulnerability in their research. Thank you very much for your